Shabbat Shalom, everyone. We're so glad you have joined us and come here on our service this morning to celebrate Shabbat, celebrate Rosh Chodesh Adar, and to mark the first National Reproductive Rights Shabbat. Towards the end of my time as a rabbi in Philadelphia, a woman in her late 20s mid to late 20s, came to meet with me. After a few moments of getting to know each other, she told me why she asked to meet. She had just had an abortion 1 week ago. She had made a pretty quick decision, so she couldn't meet with me in between. But now on the other side, she wanted to know what Jewish perspective, the Jewish tradition's perspective was. She likely would not have made a different decision either way, as she knew it was right for her or her future, but she really did want to know what Judaism had to say, and if what she did was in consonance or against or whatever, she just didn't know. So we had a conversation and we talked for a long time. And at the end, she said she felt a lot better, and then she walked out, and I had not ever seen her since. This was a watershed moment for me in my rabbinate. In that moment of talking with her and speaking with her and thinking about it after, I wondered to myself, what would have happened if I had spoken about or taught about, or more rabbis had spoken about or taught about abortion or reproductive rights before her need to consider that right herself? What if she had been exposed to Jewish ideas about abortion ahead of time? What if we spoke about abortion so regularly and became so much less taboo that it wasn't something we only spoke about in the privacies of our offices, but people knew that their rabbi was available to make decisions as they were making them? What if communities more overtly organized as progressive Jewish institutions towards a pro-choice agenda? After all, as our feminist teachers instruct, the personal is political. And this is why one of the reasons why I'm so thrilled that the National Council for Jewish Women has created this first ever Repro Rights Shabbat, where Jewish communities across the country are engaging with Jewish texts and values regarding reproductive rights and reproductive justice. And of course, as is often the case, SAJ is on the vanguard of this work, because 3-ish or 4 years ago even, a fierce group of SAJ women headed by Amy Yenkin and Sarit Golub formed a task force on this topic. And they have been organizing us since, at first with some speakers, and we did a Planned Parenthood lobby day. And then, and I know Sarit will likely talk more about this, with the incredible transformative organizing of our escorting at the Bronx Abortion Clinic, where we are very much needed, and it is also very difficult to be there. And so many women, actually so many people from SAJ have participated in that work, which is on pause due to COVID. The work is actually still going, but SAJ's organization of that work as a collective is on pause due to COVID. The reason why the National Council of Jewish Women chose this Shabbat as the Shabbat for the first Reproductive Rights Shabbat is because the Jewish views and discussion on abortion stem from one passage in Shabbat Mishpatim. In Exodus 21, verse 22 to 25, and if you have a Tanakh nearby, you can look, or those you can just listen, or I'll put a text sheet in the chat after we're done this drash. When this text in Mishpatim goes like this: when men fight and one of them pushes a pregnant woman and a miscarriage results, but no other damage or death ensues, the one responsible shall be fined according to how the woman's husband may exact from him. The payment shall be based on reckoning. But if other damage ensues, the penalty shall be life for life, eye for an eye, tooth for tooth, hand for hand, foot for foot, burn for burn, wound for wound, bruise for bruise. You get the idea, eye for an eye. The difference between traditional Jewish readings of this text and traditional Christian readings of this text lies in the interpretation of one single word, ason, which means damage or danger, or here really refers to death, a death that may result from this fight that these two men have. The Torah, as often the case, is not clear as to whom this ason is referring to. It just says if they fight and a miscarriage ensues, etc. But if there is further damage, then it is an eye for an eye. So who are we talking about for that further damage? Jewish sources read this very clearly and universally as the potential death of the mother. Were you to fight and knock her down and she were to die, then you are liable, eye for an eye, etc. But the Greek translations of the Bible, which are read by the early Christians, propose that this ason refers to the death of the fetus, assumed to have, according to them, equivalent status of a fully formed life. So based on this one very small word in the Torah, an entire debate over the centuries ensues. And our reading is very much that it is about a fully formed life of a mother. It is not about the fetus. So this text is not overtly pro-choice. However, it establishes two important principles. The first, that a fetus is not considered a full life, which is affirmed in countless other sources through the Mishnah and the Talmud. Number two, this text affirms that we are more concerned at this stage with the life or death of the woman than with the fetus. This is affirmed in Mishnah in the Mishnah which was compiled around 200 CE, which affirms that until the very beginning of the birthing process, until a life is really truly coming out, the life of the one giving birth comes before the potential life, and even to the point in which they are very explicit about the need to maim and damage the fetus in order to save a woman. There is also a line in Jewish text that sees it not only as a choice, but as a necessary thing to do, and as a positive, necessary act in order to save the person who is giving birth. As time passes and interpretations grow, we see Jewish scholars who view abortion in a little bit of a more restrictive way, meaning that they limit it to only cases where physical life of the person giving birth is going to be in danger. And you have people who view this abortion in a more expansive way and understand saving a mother's life also as implying and applying to emotional and psychological harm. But even those who disagree never ever in Jewish tradition speak about abortion as a sin or a murder. They always affirm that the life of the person who is giving birth comes before the life of the fetus or the fetus. In public conversations dominated by religious voices on the right on these issues, it is especially important that we understand our Jewish texts and values and share them in the public square to affirm that reproductive choice and reproductive rights is not just a personal option, but one that should be supported by the values and traditions of our ancestors. So now that I've given some of the background of our Jewish sources and shared a little bit about the importance of this day, I want to invite Sarit, who is one of our two co-chairs of our reproductive rights team, reproductive justice team at SAJ, to help us apply this to a contemporary framework and towards our actions. Thanks, Sarit.
Thank you so much, Rabbi Lauren. So as Rabbi Lauren mentioned, and most of you know, Amy Yenkin and I have been coordinating the reproductive justice group here at SAJ for the past several years. And one of our main activities has been serving as volunteer escorts at an abortion clinic in the Bronx. And this abortion clinic has been a particular target of very virulent anti-choice protest and intimidation. And some of you might have been there. Some of us talked about this at a previous Human Rights Shabbat back in 2018. But I'll just summarize that experience by saying that the work of escorting is intimate and devastating. The clinic is on a quiet street that is pretty far from the subway. So in order to enter the clinic, most patients pull up in a car service and they need to exit the car and walk about 30 feet to the clinic door. Anti-choice protesters usually descend on the car the minute that it pulls up. They start harassing the patients, first sort of cajoling them not to go in or telling them that the clinic is dangerous, and then quickly pivoting to threatening them and calling them names. So every time I go, I get very, very angry, but not just at the individuals who are doing the harassing, but at the system and the way that the fact that the way that our system of reproductive health care is organized requires people to seek services in this way, meaning at a standalone clinic, which deprives them of any privacy or confidentiality, divorced from any of their regular health care, and at a setting that is a visible target. And I know that you all know this, but we do not have to organize reproductive health care in this way. We do not have to organize abortion services in this way. This system and infrastructure is explicitly designed and perpetuated to impose and extract a cost, right? Emotional cost, logistical cost, financial cost, social cost on individuals who are seeking abortion services. And I raise this because I think there's a lot of media attention right now about threats to reproductive rights and the Supreme Court. And I do not want to minimize that, but I think that many people, especially those of us with extreme economic privilege and healthcare access, do not pay enough attention to the structural and systems level barriers to reproductive healthcare and reproductive justice. This distinction, right, is at the core of the concept of reproductive justice, which most of you know was coined in 1984 by Black women who believed that mainstream pro-choice movement did not fully meet the needs and lived experiences of women of color. A reproductive justice frame reminds us that a person's ability to determine her own bodily autonomy and reproductive destiny is directly linked to the conditions in her community and is dependent on economic, structural, and social systems that either facilitate or prevent access, even to healthcare and services that might be legal. So on this Reproductive Justice Shabbat, I'd like to draw your attention to two issues in reproductive justice that are particularly important right now and are directly tied to this issue of facilitating versus preventing access. And those are medication-based abortion and the national gag rule. So when I first started volunteering at the clinic, I was very surprised to learn that the vast majority of patients were simply there to receive an abortion pill. And folks may know about this, but it is the most common service provided by abortion clinics is handing a woman a pill. Medication abortion has been available for over 30 years. It was FDA approved in 2000. It is safer than Tylenol, and it is over 95% effective in ending a pregnancy up to 9 weeks. But current FDA regulations on this medication, the first medication that's needed for medication abortion, which is mifepristone, requires what's called a risk evaluation and mitigation strategy, or a REMS. REMS are usually reserved for drugs with serious side effects, complications, contraindications, but the REMS for this particular abortion drug has 3 components. It requires that the pill be dispensed to patients in person. It restricts, so not by mail, for example. It restricts the dispensing to specific healthcare settings. It does not allow dispensing in any pharmacy. And it requires that any provider who's prescribing the medication needs to be registered with the drug manufacturer and has to order and stock the abortion pill in their healthcare facility. What is interesting is that patients do not need to take the medication under the supervision of the provider. They just need to receive the medication from the provider. So it is unclear how this REMS is actually mitigating any harm. If you're like, well, we're worried about this because of the medication, but the actual administration of the medication can happen anywhere that the woman chooses. And of the 20,000 drugs that the FDA regulates, this is the only one that has this requirement that you have to pick it up in person, even though it can be taken at a later time. Other drugs that require in-person administration are things that need to be supervised, like IV medication. And these regulations limit the number of providers who are willing to prescribe the medication because they have to stock it. Many of them don't have the volume or capacity to do so, and because they have to place themselves on this registry, which makes them a target of harassment by anti-choice agitators. If patients could go to their regular doctor to seek this pill and then pick it up at a regular pharmacy, all of the issues that we encounter in our escorting would be averted. And in fact, the expansion of telemedicine and medication delivery right now during COVID might make this process even safer and more private. So is anybody doing, obviously, aren't people doing something about this? Yes, the ACLU currently has a lawsuit pending. The American College of Obstetricians and Gynecologists, ACOG, tried to suspend in-person regulations during the pandemic. You may have heard about this. It was successfully challenged by the Trump administration at the Supreme Court. That happened just January 12th. That was Amy Coney Barrett's first ruling, abortion-related ruling as a Supreme Court justice. But there are also a series of advocacy groups, senators, US representatives that are urging the FDA. And I want to draw your attention to the fact that these FDA regulations were created under a Democratic president in 2000, President Clinton, and revised under a Democratic president in 2016, Barack Obama. Today, the Biden-Harris administration could take immediate action to suspend enforcement of this in-person requirement during the pandemic, which is consistent with the government's approach to all other medications right now during the pandemic, and initiate a comprehensive FDA review of the current restrictions. There's a ACLU campaign for that right now. There's a number of super innovative reproductive justice groups that are creating systems to circumvent these regulations right now. If you're interested in any of these, our reproductive justice group has a list of resources, and we are talking at subsequent meetings about ways to support efforts in this area. The other topic I want to make sure that people understand is the domestic abortion gag rule. You probably have heard, maybe you have heard about the global gag rule, which bars international health organizations that receive US funding from providing any abortion services or referral or information. Even though no US money can be used to provide abortion services, but even if any abortion information or referral is provided by international organizations, they cannot receive any US funding. Biden has already reversed this global gag rule, but there is a domestic gag rule here in this country that was enacted by the Trump administration through HHS in 2019. And it focuses on any programs that receive Title X funding. Title X is the federal program that gives grants to healthcare providers. So people who are uninsured or underinsured can get birth control, contraceptive education, STD testing, breast cancer screening. Under this domestic gag rule, any provider who receives Title X funding is prohibited from counseling about abortion, giving an abortion referral, or even mentioning abortion in counseling a pregnant patient, even if the patient explicitly asks about it. And so the number of clinics who serve primarily underserved women, because those are the clinics that receive Title X funding, are effectively gagged in this way. The Biden memo that got rid of the global gag rule directs HHS to, quote, take immediate action to consider whether to rescind the regulations. I don't feel like that's strong enough. He can't do it by executive order, but it is critical to maintain pressure on HHS to change these regulations immediately. So I started by talking about this distinction between rights and justice and the importance of focusing on how principles of equity or human rights are actually applied in practice. The work of reproductive justice and any social justice work is the creation and maintenance of systems and infrastructure that ensure a just and meaningful application of human rights. But the other critical component to a reproductive justice frame that I think is very important to remember at this moment is that reproductive justice places reproductive health issues and abortion into a larger context and focuses on the connection between controlling or limiting decisions about bodily autonomy and reproduction with issues of population control, immigrant rights, economic and environmental justice, sovereignty, militarism, and criminal injustice. I think it shouldn't be lost on us that even the component in the parsha that we derive some of our pro-choice stance from within Judaism is completely based on women as property. And I think that this focus, this reproductive justice focus, draws our attention to the extent to which social and political movement to control reproductive freedom and autonomy is inextricably linked to fighting against larger systems of oppression. And this is a topic for another talk, but I would like to draw your attention to the fact that scholars and activists have been increasingly understanding the connections between white supremacy, anti-Semitism, and the militant anti-choice movement. And Dr. Carol Mason has led a series of webinars for national advocates for pregnant women that I would really draw your attention to, that discusses the lack of coverage of the role of the anti-choice movement in the January 6th insurrection, and the ways in which militarization of the anti-choice movement draws heavily on anti-Semitic rhetoric and tropes. And at this moment, it is critical for all of us to recognize the insidious and explicit connections among these ideologies and marshal our voices for action against them. A commitment to reproductive justice is one of the hallmarks of a Judaism that stands for all, and I'm grateful for the opportunity to share these ideas with you on this Reproductive Justice Shabbat.